Dear learners, welcome to this presentation on Posology Part 2. After watching this video, the learners will be able to define posology and understand and know the factors influencing those. In the Part 1 video, we have studied what is posology and different factors influencing those. Remaining factors that we are going to study in this video are synergism, antagonism, emotional factors, habituation and addiction, idiosyncrasy, hypersensitivity, tolerance, and finally tachyphylaxis. Now let us study one by one each of these factors in detail. Synergism. Now what is synergism? When two or more drugs are used in combination, their action is increased. This phenomena is called synergism. It is very helpful when desired therapeutic result needed is difficult to achieve with a single drug. Synergism may be addition. That means when the total effect of two drugs is just equal to sum of their individual effects, it is known as addition. Or synergism may be potentiation. Potentiation means when the combined effect of two drugs administered is greater than sum of their individual effects. It is known as potentiation. Synergism is very useful where desired therapeutic results needed is difficult to obtain with a single drug, especially if single drug produces side effects. By this action, dose of individual drugs can be lowered. Next factor influencing dose is antagonism. When the action of one drug is opposed by the other drug on the same physiological system, it is known as drug antagonism. For example, milk of magnesia is given in acid poisoning. Here, one drug is acidic and other is alkaline. They react with each other, or in other words, it may be said that effect of one drug is antagonized by the other drug. Another example is if adrenaline and acetylcholine are given together, they neutralize the effect of each other because adrenaline is vasoconstrictor whereas acetylcholine is vasodilator. Next factor influencing dose is emotional factor. Females are more emotional and responsive to drugs, therefore require less dose of drugs. The faith inspired by the doctor on the mind of a patient is an important factor in medication. Nervous patients require smaller dose of drugs as compared to normal patients. Next factor influencing dose is habituation and addiction. Now let us first see what is habituation. When repeated use of a drug or agent leads to production of emotional or psychological dependence rather than compulsion. The condition is known as habituation. For example, use of tea, coffee, tobacco, chewing of bitter nuts, etc. When such agents are withdrawn, the individual can carry on his routine work. There is no physical dependence, hence it is easily overcome. Now let us see what is addiction. It is a state of psychic and physical drug dependence. Continuous use of alcohol, opium, morphine leads to addiction. If the person is unable to get the drug, he develops withdrawal symptoms which may be serious to produce death. Next factor influencing dose is idiosyncrasy. All persons do not respond alike to the same drug due to varied individual susceptibility. Some may produce abnormal reaction to a drug, an extraordinary response to a drug which is different from its characteristic pharmacological action is called idiosyncrasy. For example, few milligrams of aspirin may produce gastric hemorrhage. Another example is small doses of quinine may produce ringing in the ears. Next factor influencing dose is hypersensitivity. It is an allergic reaction to a drug and is different from expected pharmacological response or toxic reaction to a drug. This is due to frequent or indiscriminate use of drugs like antibiotics, vitamins, and proteinous substances. Once a person is sensitized, a minute dose of drug will produce allergic reactions. Hypersensitivity is of two types. First is immediate type, which is serious and requires prompt injection of adrenaline, otherwise death may occur. Second type is delayed type, in which urticaria, skin rashes, or contact dermatitis may occur. Next factor influencing dose is tolerance. When a drug is administered in an ordinary dose, it fails to produce normal therapeutic effect and requires large dose of drug to produce normal effect. The unusual resistance produced is known as tolerance. For example, smokers can tolerate nicotine. Another example is alcoholics can tolerate large doses of alcohol. Another example is rabbits can tolerate large dose of atropine due to quick destruction of drug by the enzyme atropine esterase present in their blood. Now let us see next factor influencing dose, that is tachyphylaxis. It is also known as true tolerance. In certain drugs, it is observed that when they are administered repeatedly at very short intervals, the cell receptors get blocked up and pharmacological response to that particular drug is decreased. By increasing the dose, this decreased response cannot be reversed. But if the administration of the drug is stopped for a long time and administered again after being discontinued, then the initial effects of the drug can be reobserved. This condition is known as tachyphylaxis. For example, drugs like ephedrine, amphetamine, cocaine, and nitrites behave in this way. Thank you for your patience listening. Keep learning. In this part 2 video, we have studied the factors influencing dose. If you like this video, press like button, and for more videos, please subscribe to my YouTube channel. Thank you for your patience listening. Keep learning.